Welcome to Healthy Happy Hour. This is our Healthy Happy Hour for August of 2020. And we thank everybody for tuning in and still sticking with us through this COVID epidemic. You know, we had to switch some things up. We would love to be face-to-face, but we got to stay safe. So we want to make sure that we continue our Healthy Happy Hours. So we're going virtual. So from now till whenever they let us back outside, we'll be doing virtual Healthy Happy Hours. So to keep things going, we got a good one for you this week, or this month rather. We're dealing with HIV and dentistry. So we had to go get a great person that we know who can give you great information. So she's the dental director of Neighborhood Medical Center, and her name is Dr. LaToya Butler, and she is going to give you guys a lot of information about HIV and dentistry. So I'm going to shut my mouth and allow her to do her thing.
All right. Good evening. Thank you for that introduction, Joe.
No problem.
So, usually, I like to have an open conversation or open discussion about HIV and dentistry because a lot of times there's more questions than me just giving information. So what I'll do, since we plan to do a series of these, is just provide some introductory information about what we see as dentists and what you can do to help yourself stay healthy, in addition to helping you stay healthy.
Right.
So first, starting out with HIV, just as any other virus or any other ailment or condition, it usually manifests itself or shows up first in the mouth. And believe it or not, there have been many people undiagnosed with HIV that we've seen oral conditions for, that we can then say, hey, you know, this might be a good time to be tested based upon what we see in the mouth. Right. I do have a couple of pictures to show those conditions, and that's how I'm going to guide our conversation, to show you what are some of the things that we see, why we see them as it relates to your disease, how you can help keep yourself safe, and how we can treat each of the symptoms that may show up. Usually in the past, when treating HIV patients, I've noticed similar concerns and fear, because you see these things pop up and you have no idea that it is absolutely related to having HIV, but they aren't treatable. So if we can at least allow you the opportunity to identify them, you won't be as afraid when you see it, and you know how to go get the treatment from us, the dentist. So we'll get started with a couple of those conditions, and I'm going to share my screen so that you can see pictures of those, and I'll give a pretty vivid description of those so you understand what they are. Cool. So our first one would be not so pretty. I will let you all know that some of these pictures are not tolerable by most people, but just so you know what they look like. The first picture here is oral candidiasis. You've heard people say thrush, something you usually see in babies because they got milk left over. But a classic sign of HIV, advanced stages of HIV moving into AIDS, are patients having thrush. These are little white lesions that we can see on the tongue, on the cheek tissue, on the gum area, all around the mouth, but they're removable. And what I mean by that is you can take your finger and wipe this off, but it will return unless we treat you with an antifungal. Usually we treat with nystatin, and you can swish your mouth. It helps eliminate it, but it recurs as long as your viral load is up. So that's another indication of how healthy you are with HIV if you see oral candidiasis. Our next condition is the same on this picture. I do want to describe a major difference with seeing this in the mouth versus this in the mouth. So this, a regular person's tongue can look like that, and that's just because they hadn't brushed. So someone who's healthy, their tongue can still look that way, but if there is thrush present, you can wipe this off, and it'll look more like little circles or beads, maybe cottage cheese in a sense. than just flat out seeing a white. We call this coated tongue, COATED, coated tongue. But if it wipes off and looks kind of like that, that's oral candidiasis. This is coated tongue.
Mm-hmm.
So moving forward with another condition that we see, this picture here, it looks like, I'll let you guys say what it looks like.
Crack mouth.
Yeah, it looks like the mouth of somebody that I would see who used drugs a lot or something.
Mm-hmm.
Okay.
Or meth mouth.
Okay, that is true. Also, this is actually what we call the lateral border of the tongue, but you would simply just say the side of the tongue. So this here is what we call oral hairy leukoplakia. It is simply a white lesion on the side of the tongue, but this one cannot be wiped off. So the reason it looks like this with these little lines or striations is because your tongue naturally has that feature from the type of taste buds that are there or the type of cells that are there in the tongue. So that is usually visible. With this condition, we just try to make sure that you're healthy by diet and things as such to keep your viral load also down. It's usually not painful, but in some patients, it has appeared to be painful. Do y'all
like it?
That one's really not a painful one, but the oral candidiasis, if it's been there for a long time, it can hurt because when you remove it, sometimes it leaves a little red target lesion.
So how long does it usually take for any of these, the candidiasis or the leukoplakia? How long does it take it to actually develop in the mouth?
So usually it's patient based, and that is according to how high a viral load is, how whether or not the patient is has enough nutrients or vitamins in their system. But it can actually go away pretty quickly once we identify it and make sure that they're taking the correct medication regimen, and they usually subside in 7 to 14 days if everything else is done properly.
Okay.
Moving forward to our next lesion here, this is called red band gingivitis. So basically the patient's gums are inflamed, and in any healthy person, we would see red consistent all over the mouth. But right now it just looks like a band going right around the edges of the teeth, or what we call gingival margins. That will subside, and you can see these teeth look kind of dirty, right? Look kind of chalky. Well, all we really have to do in a case like this is get it cleaned up really well. We can prescribe a medicated mouthwash, which will help take the bacterial load down. And then in about 7 to 10 days, if you're brushing and flossing properly, this will go away and it'll start to look like normal gingival or gums.
So I heard you say red band gingivitis. Is it also different colored gingivitis or different stages of gingivitis as well?
So there's not a different stage per se of gingivitis, but the color can differ based upon the patient's color of their gingival or their gum tissue. So like me, I have more melanin in my skin, so I have more melanin in my gums and they're darker. But it will still show up extremely red right around the line.
Okay.
Right.
With our next lesion here, okay, this one can get pretty nasty. I can be honest, when I see it in the mouth, I have to take a deep breath first because it can also carry an odor. This is a necrotizing ulcerative gingivitis. In this case, it looks more like periodontitis, and I'll break that down. So necrotizing just means that the cells are dying. Ulcerative, it's created a crater in the tissue. So that's where you see looks like a little ulcer. And then gingivitis will look more like these inflamed, puffy gums. But here I say periodontitis because I'm starting to see more of the tooth. The tooth is starting to look longer, but that's because I'm starting to see the root of the tooth a little bit. That's when it's then periodontitis. This is usually treated by getting a deep cleaning, scaling by the hygienist. Some dentists do those also, but we usually like to give this over to the hygienist to clean up. Once it's cleaned up, we may give some type of topical or a steroid to help eliminate it. But diet is really key for eliminating this condition and keeping the teeth clean. Now, me, of course, a whole bunch of other issues on here, but that's already the HIV.
Is there a time frame for this stuff to develop, or like what is the time frame for as far as development? Because I see you talk about the process of getting rid of it, but what's the time frame for this stuff to develop and to be seen?
So usually with necrotizing ulcerative gingivitis, it's also called NUG. These usually don't show up until somebody's viral load is completely over the threshold of HIV, and then they go into the diagnosis of AIDS. It does not mean that if you have HIV, you can't see this. It's just usually common in patients who have then been diagnosed with AIDS. So once again, the increase in viral load is what determines that. And sometimes increase in viral load manifests differently per person. So we have to do everything patient-based, case by case.
Okay. Has there ever been a time where you had a patient come in with more than one of these conditions going on in their mouth?
Yes, there has been. Not recently, but I know I have seen it several times in the past. And actually, my first experience with it was when I was just in dental school as a student. So I have seen this time and time again. It is something that is terrifying for the patients because they don't know. And actually, oftentimes when I see these conditions, those patients are undiagnosed. They didn't even know they were HIV positive. So it gives me the time to have a conversation with them on education and to help them not be fearful of what they see.
Okay.
The next lesion that we have here is actually a cancer. It's called Kaposi sarcoma. In the past, in the 80s, when everything became common with AIDS, or it was a pandemic at the time, they said this was only seen in men, and preferably men having sex with men. Well, at this stage, we noticed that women still have that lesion, and people of Asian ethnicity tend to have this lesion also, but it's definitely still more common in men who have sex with men. I am not exactly sure why. Research changes with this lesion or this cancer ever so 10 to 15 years, but I still hadn't found out exactly why that happens. But usually what we do when we look in the mouth, sometimes we can see it on the roof of the mouth, cheek of the mouth. Sometimes it's far back as the soft palate, and it's literally raised purple lesions. And the reason raised in purple is because within this lesion, not only are there cancerous cells, but new red blood cells and white cells are still forming within this one lesion. So it looks darker or purple. The two lesions that we have here, these are actually my last two lesions. They're commonly seen. And the reason I saved them for last is I would hate for anybody to see these lesions in their mouth and say, oh my God, I have HIV. No, you don't. Chances are you don't. If you do, you tend to know, but there are other signs that guide us to, say, hey, you may want to be tested, or here's how we should treat. So this particular picture is herpes simplex type 1. It's also called a cold sore. We usually see this very prevalent in HIV patients who already have herpes simplex type 1. Just because you have HIV doesn't mean you're going to see this lesion. Usually this is a co-infection or, something somebody contracted in childhood or at birth. They get cold sores and it just happens. But with this particular lesion, we do over-the-counter Abreva. We do not perform dental work on patients who have an active lesion as such as this, because if we disturb the lesion and one of those vesicles pop and some of the pus comes out of it, wherever it touches, it then spreads. So if we happen to touch a glove, go in your mouth, then now you're going to start having outbreaks inside your mouth versus just the commissure, as we call it, or the corner of your mouth. Okay. So with these, if you already have herpes simplex 1 and HIV, those recur a lot more commonly than if you didn't have HIV and just herpes simplex 1.
Okay, and is basically the way you saying it, it seems like it's acting as if an opportunistic infection because the immune system basically opened the gates up.
Exactly, and that's for all of these. Everything that I'm showing you, it is not caused by HIV. They're just symptoms that accompany HIV and are exacerbated or made worse because the immune system is compromised.
Right. Okay.
So our final lesion is here. It's called a canker sore. People call them canker sores, gumballs, that good stuff. It hurts like, I'll say crazy, when you get anything on it. It could be your own saliva and it burns. The reason I say this last, people who tend to have hypertension also usually get these a lot. And that's another thing that manifests when we see HIV. We see these lesions, and there can be numerous amounts of them, but it doesn't necessarily mean that the viral load is increased or low either. What this usually signifies is some type of trauma at times. Maybe you bit a chip and it cut your gum tissue or anything like that. But usually when the immune system is weakened, we see more of them in clusters. Another name for this is aphthous ulcer, minor or major. This is a minor because it's in that one little spot, but if we see a bunch of them, it's major. Usually with this, I tell the patients, that old remedy that your grandma or somebody said, put some salt in it, and you got to sit there and hold your eye because it hurts so bad. I don't say to do that anymore because it's self-limiting. It kind of heals itself within 14 days. Right. There is an over-the-counter product called Zilactin, Zilactin, that you can put there. Now, when you put it there, just hold on to something fast because it hurt. But it creates a film over this lesion, and that film is for a protectant. Now, you might have to replace the film in the next 8 hours, but it helps it to heal, because in order for these to heal without giving you much trouble, you have to keep it as dry as possible. Well, how am I going to do that if it's in a wet location? So that particular product helps to heal those faster than the 14 days.
If those last more than 14 days, should they go to the doctor or see a dentist if they last more than 14 days?
Because it's just a canker sore, usually not, because we still can't do much for it besides say, here's a medication that you can take for it. Now, if it persists for longer than 14 days and then you start to see other things around it, maybe the hole is getting larger or maybe other types of lesions are starting to pop up, then yes, I would say to come in to see us, because we would have to treat those lesions differently from this canker sore.
Gotcha.
The only thing that I don't have a picture up here for, but it's self-explanatory, it's called xerostomia or dry mouth. That is very common in HIV, probably more common than anything else that you see here, and that is usually due to the medications that are prescribed or being taken. Dry mouth not only is uncomfortable for you, but it is detrimental to your teeth. Right. Because you producing saliva creates some sort of a barrier to your teeth to keep you from getting cavities. But if you don't produce enough saliva, the mouth is dry and it's a dark space, all that bacteria sets up and does exactly what it wants to do, and then you end up with a mouth full of cavities. So to prevent that, we usually, some people, somebody at church or something might pass you a peppermint, or your folks might say, hey, go suck on a piece of candy. Well, I don't want you to do that. I want you to use a saliva substitute. And the reason I say no candy is because sugar on top of a dry mouth in a location where cavities are going to form is going to just make it worse. So we usually say sip on some water, sugarless drinks if you need to. chew some sugarless gum, sugarless hard candy, but nobody really wants that. But you do need to
Right.
avoid tobacco, avoid alcohol, avoid salty foods. And at night, and it may not seem important, but when you're sleeping at night, your mouth is slightly open. If you sleep with a humidifier in the room, it produces some moisture for you. And that moisture can help signal to your salivary glands, hey, let's produce a little bit of saliva so that we can get some protection. But those are all the major things that are seen with HIV that are very common, that are treatable, that people usually have no idea what it is when they see it.
Right. Right. So, because I've heard about the dry mouth, because I understand, the mucosal membrane of the lining of the mouth, it needs to be moisturized all the time. But I never really thought about it and I guess how it would work with any disease in the mouth other than trauma to the mouth. But I never just thought about it with the diseases in the mouth, how it could help or hurt it as far as allowing them to grow in the mouth.
Mm-hmm. So let's think of this. If I am picturing a tooth, and we'll say the saliva on the tooth kind of helps washes away any sugars that you come in contact with food. And I don't mean sugars as in candy. What I mean by sugars is the foods that we eat all break down into certain types of sugars. So those refined sugars that break down, they usually hang around a little longer. Well, the more moist our mouths are, the less likely they are to attach to a tooth.
Okay.
So the fact that you don't have the saliva being produced, you got all of this environment for them to attach to and actually go into these little micro holes that are in the teeth that you can't see. And that's how the cavities begin to form.
Okay. So would it be wise to just make sure you are drinking water before you go to sleep to help keep some moisture in your mouth?
It would be wise. Definitely. It's definitely wise, not only just to keep the moisture, but the fact that you drank some water kind of neutralizes your mouth, because your mouth, you never want it to be highly acidic. Whenever it's
Right.
highly acidic, that's when you form cavities. So the fact that you drink water not only gives you the moisture, but it also eliminates some of the acid.
Okay. That makes sense.
Yes. Hopefully it makes sense.
Cool.
Well, are there any other questions that you might think you'd have that you just didn't know didn't make sense?
What are some of the what are some of the fears that you get? Because a lot of people are scared to go to the dentist. Like they might be in excruciating pain from HIV or not from HIV. But what are some of just the stereotypes that you see a lot of with people not wanting to go to the dentist?
So from experience, a lot of time, especially with HIV positive patients, they're afraid to share their status, for starters. And because of that, and because of in the past, people were treated differently, but we have standard precautions and we have things in place where we treat patients the same regardless of their status, which is a universal precaution. Usually patients come and they will not tell us their status at all. And we can still see some things that lets us know what's really happening. And when we actually sit down to have the conversation with them about how important it is for them to know that we do understand, that they don't have to feel ashamed, because shame is usually number one reason why they don't come. But when we actually sit them down and say, you don't have to be afraid, you don't have to feel ashamed, we're here to help you, but my way of helping you is teaching you some of the things that I've already shown you, then they start to open up and feel more comfortable about actually being treated by us. But they also don't want to come in and see a provider, a doctor, or the hygienist or an assistant who's like, uh-oh, this patient has HIV, let me put on more gloves. That's the kind of behavior that is not tolerated with dentistry or treating patients at all. But it's some of the things that are out there to make people not come to see us.
Right. So with people who may have these different diseases in their mouth and they smoke and drink on the regular, let's say that's their coping method, smoke and drink, how could that make things worse for them as far as their oral health?
Okay, so usually with drinkers and smokers, because the immune system is already suppressed, especially with smoking, smoking makes all the blood vessels become smaller. When that happens, because your teeth are actually sitting in bone, all of those teeth are fed their nutrients through blood vessels that are going through the bone. When those blood vessels are starting to shut off, you no longer get the nutrients to those teeth. You no longer get the nutrients to the bone, and you start to lose the bone, which when we saw earlier periodontitis, the teeth start to look longer. You're looking long in the tooth. You start to see the root. That's what happens, which eventually leads to tooth loss.
Okay. Okay, that makes sense. It is. It's also kind of a catch-22 because especially a lot of populations that we deal with, that's people's coping methods. Those are things that they do to cope, but at the same time, it's hurting them. So I know we try a lot to get them to see that, to try to make a healthy change so they can be healthier. So.
Right. And oftentimes I've seen the biggest issue with that is they just don't know. And so in order for them to know, it's our jobs in the community who see them first to encourage them to come to see us so that we can further educate them so that they don't make these very serious mistakes. And the reason they're mistakes is because they just don't know.
Right. Right. Okay. Makes sense. Got any more up to your head, Ian?
No, I think I'm pretty good. I'm definitely finna go brush my teeth.
Right.
Definitely finna go just off them pictures right there. I'm definitely finna go.
So, but now you got me intrigued. What you gonna talk about next time? Because now that was good because I knew about the Kaposi sarcoma and the hairy. I can't even think of the name. Right, because I've seen that in slides, but they never really broke it down of how it affects and how it grows in the mouth. They just say this is something that's there. So I appreciate you breaking that down because give people that insight of, well, this is from start to finish how this process can work. So.
Of course. So in our next topic, we can continue and review some of those things just for those who might have missed it. But also I wanted to focus on diet with HIV and how it relates to not only taking the medications, but what you'll see in the mouth when there's a diet deficiency. Because believe it or not, all of those conditions that we talked about, which are treatable, can also be painful, and that can prevent somebody from taking their medication.
Right. That's true. That's definitely true.
So we would definitely continue the conversation with nutrition or diet.
Okay. Now I'm looking forward to that. Now you got me ready for it now.
Make sure I lose a couple of pounds so I won't have a little extra chin while I'm telling people how to and eat right.
So, but thank you for your time. There's great information. We're going to make sure that those who weren't able to catch this live, they will definitely catch the playback of it. Visit www.neighborhoodmedicalcenter.org for more information about Neighborhood Medical Center. Definitely make sure y'all check out our podcast that we got coming out because, you just don't know it, Dr. Butler, but you're on our calendar for our podcast too.
I'm there.
I'll see you again. So Mind Your Body and Soul, the Healthy Podcast, name of it, and it's hosted by myself and Mathias, and Miss Steaple is our guest host. So the three of us, we're doing this thing with Ian in the background helping out. So .org/NMCpodcast.com is how you can catch us. We're going to be on all major podcast platforms, Anchor, everything. So you won't be able to not hear us. We'll have a Facebook page, YouTube channel, all of that. So you all make sure you tune in. And this Healthy Happy Hour will also be streaming this. Well, we'll put it back out through Facebook and we're going to put it on our YouTube channel. So people will get a chance to see all of this. So This is our Healthy Happy Hour. Remember, we do this once a month, every third Thursday of every month. So we will be back next month on the third Thursday. Tune in, tell a friend to tell a friend to tell a friend so y'all can come get this good free information. And once again, this Dr. LaToya Butler, she is she's the dental director for Neighborhood Medical Service. And so a shout out to Ian, the IT guy, making sure that we go how we go, because he came in and saved our lives today. So
hey, just the it guy, man. I'm just the guy in the back, making sure everything run properly. It's all on y'all.
Thank you.
Man, look here. We appreciate you. But until next time, we'll see y'all later.
All
Peace
right.
out.